The anterior cruciate ligament, or more commonly referred to as ACL, has become one of the greatest phenomenons within the sports world today. ACL tears have landed as one of the most common knee injuries, with over 100,000 ACL tears in the United States occurring annually. Most ACL tears are a result of landing or planting in a cutting or pivoting sport, with or without contact. Some of these include soccer, football, basketball, and so on. Unfortunately, it has also been shown that women are much more susceptible to this injury due to the angle from their pelvis to their knees to their feet, in comparison to males. This picture illustrates what a normal uninjured ACL looks like on the right in comparison to an injured ACL on the left. If we take time to understand our ACLs and ways that we can prevent our athletes from injuring themselves, hopefully we can cut back on the number of ACL injuries. This picture shows what the anatomy of the knee in an uninjured ACL should look like. From this, we can see that the origin arises from the posterior medial corner of the medial aspect of lateral femoral condylide in the intercondylar notch, with the insertion at the anterior to the intercondyloid eminence of the tibia, being blended with the anterior horn of the medial meniscus. Although it does stretch as the knee bends, the ACL prevents the tibia from moving forward or medial towards the femur. To try and prevent injury to our athletes, there are several exercises that we can use to help strengthen our athletes' legs and ACLs using body weight, free weights, or exercise machines. There are several ways athletes can strengthen their legs and ACLs with the use of their body weight. While keeping feet hip-width apart, athletes can perform squats by sitting back while standing and bending from the hips and knees. This can also be performed on one leg. Walking lunges is another technique used to strengthen ACLs by lunging forward, pushing off one leg at a time, while dropping their back knee straight down. They can continue this motion by walking forward. This can also be implemented by lunging in a backwards motion. Several exercises athletes will be able to perform. While using a stepping box and the appropriate size free weights, athletes can step up and down on a bench about 9 inches high. They should step up with either the right or left leg and step down with that same leg. While using the box and the free weights, athletes can also perform calf raises by dropping the heels of their feet over the edge of the box, and while maintaining balance, lifting themselves up onto their tiptoes while remaining on the box. Athletes can perform various exercises previously discussed with the use of free weights, such as lunges. As shown, athletes should stand with one leg in front of the other, when bending with the front leg to lean forward and return to a standing position. Rather than walking, athletes can remain in a static position and continuously lunge forward, then bringing the leg back to the starting position. Squats can be performed with the use of free weights as well. Being held in an upward position with elbows locked at a 90-degree angle, athletes should make sure to keep themselves in an upright position. With the use of the stability ball, athletes will start in a position as shown by lying on the floor with their backs of the calves resting on the top of the ball. Athletes should lift their butts off the floor by lifting hips towards the ceiling and pulling the ball in with their feet. To complete this exercise, the ball should be pushed back out to the starting position and then repeated. The use of machines can also be a great asset to use when strengthening an athlete's legs and ACL. With the use of a squatting machine, athletes are able to use additional weights when keeping themselves in an upright position while lowering themselves as previously discussed. A leg press can also be used by positioning themselves on the seat with feet hip width apart with knees at a 90-degree angle, and to push themselves with their legs into a straight position. With the use of the combination of these exercises, we can hopefully prevent many ACL injuries in the future for our athletes.